So New South Wales reported 7 new locally acquired cases of COVID in the past 24 hours to 8 p.m. And of these, 6 cases are linked to the Avalon cluster. 1 case remains under investigation. The cluster now numbers around 122. The case under investigation is a firefighter from the Northern Beaches with links to the Belrose Hotel. And there were 4 new cases were acquired overseas, bringing the total cases in New South Wales to 4,669. There were 23,933 tests reported to the 8 p.m. last night, compared to 39,133 on the previous day. Can I express my gratitude to the community for continuing to come out for testing over the festive season, but I can't stress enough how important it is that anyone with the most minimal of symptoms across the state. We are at a critical stage in our response, and unless we have those high testing rates, it does not give us adequate assurance that we are not missing undetected lines of transmission. Obviously, we supplement this by intelligence from our sewage surveillance, but it is imperative that people continue to get tested. We'll also be asking that people who have been in isolation, particularly at those venues associated with transmission or household contacts, get tested towards the end of their incubation, their 14 days period. And again, that gives us another level of assurance that we're not missing unrecognised disease in the community. So the case we had in the firefighter was locally acquired and under investigation, is that of a resident in the Northern Beaches who had attended the Belrose Hotel. And I think at this point it might be useful if I just go back with a bit of a story around what we know about some of the cases we've had and their linkages to the Belrose Hotel. So you may recall a few days ago I mentioned that there was a young gentleman in his 20s who worked at the Belrose Hotel. That young person had come forward appropriately for testing because of the precautionary approach of him and his family. I can confirm that he has not transmitted to our current awareness to his family, his close contacts or his work colleagues. But what we're concerned about is understanding how this young man got the disease. So whilst he was tested on the 23rd of December, when we looked and undertook serological testing, so that's a blood test, to get better further understanding of his timing of infection, it indicated that he'd been infected about 2 to 3 weeks ago. And then when we take a history from him as well as his mother, he had a very transient illness associated with a very short period of fever on the 10th of December. So basically he came home from work, a bit tired, and then went to bed, woke up with a bit of took his temperature, was a bit of fever, and then woke up the next morning and totally fine, no fever. So very transient illness at that time, but he's come back positive. So based on that, we looked. There was also someone else who attended one of the cases, who attended the bottle shop at the Belrose Hotel on the 17th of December, but this young gentleman was not working in any way. He never works in that area and was not the source of that person's infection. We then did workplace contacts around that 17th to look at potential issues, and those work colleagues were negative. Yesterday I called out the fact that we wanted upstream testing, and I'd asked people to come forward that had been at that Belrose Hotel. And then this new case in the fireman actually attended the Belrose Hotel on the 11th of December for 1.5 hours. But can I emphasise that the earlier case, the gentleman in his 20s, did not attend on that day. So we're not looking at the gentleman in his 20s infecting this firefighter. What we're looking at is for the missing link. Who else was present at the Belrose? So what we're actually asking people to do is anyone who was at the Belrose Hotel any time between the 12 to 6 p.m. on the 11th of December, we're asking you to get a test. Irrespective of whether you have symptoms or not, please go out and undertake testing. And then generally, if you've been to the Belrose Hotel and have the most minimal of symptoms, please get a test anytime in December. And even if you historically had an illness that you think in retrospect might have been compatible with COVID, please get a test and please isolate until you've got that negative test. Now, the reason we're just saying get a test and then you're free to go is because the 11th of December is a while ago. So we would have expected to pick up any transmission in that period of time. In terms of the case, yesterday I indicated about a Bondi case that we were investigating. That's still under investigation. All indications are that this result may be a false positive, but we are convening an expert panel to review all the information around this case to come to a definitive conclusion. And I just again want to thank that case for undertaking testing and assisting us with our investigations. Since 8 p.m. last night, there have been one new case linked to the Belrose Australia Hotel in Erskineville and a household contact of that case. These will be reported in tomorrow's numbers. But again, I'm using this as an illustration why the 14 days is so critical. We are seeing people come forward who develop symptoms that 10 days or so after the exposure, right up to that 14 days. So please stay in the isolation for that 14 days. Please get a test before you leave isolation. In relation to the Sydney to Griffith flight, as we indicated yesterday, a person who flew from the Sydney to Griffith on Monday the 21st of December has since been confirmed as COVID positive. Again, stressing this person flew before they knew they were a close contact of a case and did nothing wrong. There were 28 passengers and one flight attendant who flew on the flight, which left Sydney at 2:10 p.m. and arrived at 4:20 in Griffith. All have been contacted. 19 results are negative so far, and with testing on the remainder pending. Again, the 4 million mark is a milestone, but I just again urge everyone to come forward for testing. And also the sewage surveillance, which we've been enhancing over recent months, has been done for a lot of the coastal communities, and to date we have not had any positive detects from those coastal communities. But can I also urge in those coastal communities, please come forward for testing. We can't rely on sewage surveillance alone. We need you to come forward for testing. But we have had a detection in the Warriewood, Hornsby Heights and Brooklyn catchments, and New South Wales Health is aware of recently positive cases in these areas, but again urges local residents to come forward and get tested if they have even the mildest COVID symptoms.